and using a variety of strategies from reducing costs of care, from shortening the investigation and treatment durations by using technology very aggressively, and constantly building and rebuilding and maintaining trust in the community. We managed to um, raise the compliance from the 25% to about 70%. Even now 30% of patients don't complete treatment. But what I want to use the next few minutes is to share with you our thoughts for the future. There are a few things that we obsess about. One of them is democratizing access to care. So, difficult geography, difficult terrain, inclement weather is not supportive, organized transport is not easily available. For a variety of reasons, patients are not able to come back to the hospital for cancer care. And so, our thought is to we have a hospital in Silchar. We're looking at the government of Tripura gave us land in Dharmanagar to put up a hospital in Tripura. We're looking at putting up a hospital. So two, three, four hospitals, each served by satellite clinics. So we have several, we started with a couple of satellite clinics supported by CDAC to test a telemedicine software. And now that has gone to about 7 or 8 satellite centers around each hospital. And each of them we want to serve by what we call as PEP centers, prevention, early detection, palliative. These are one-man shows, one-man services with a healthcare worker on a two-wheeler who can travel to corners. Even then, there are places where a bike will not travel. He has to park the bike and walk for several uh, kilometers to access a patient's house. But they will be able to deliver palliative care. We operate and send the patient home. They can remove drains, remove sutures. So variety of services can be provided by that one trained helper. And all of this, we hope, will be linked on a technology platform. We have a great IT team, and so we're looking at democratizing access as much as possible. Alongside, we also realize that healthcare, education, livelihoods, and several of these several of these are very closely, intimately linked to one another. See, what happens is we provide low cost or no cost treatment in the hospital. But even then, education in Assam is free. But even then, when the father or the mother falls sick, the first casualty is education of children. Children drop out because 80% of our patients work for daily wages. And so, early years when the children would not go to school, it used to make me righteously angry. How can kids drop out of school? But then it took me a while to understand that this is a necessity. If the breadwinner is not earning, somebody has to bring the food home. And there are large families. And so now I've come around to accepting that kids will drop out of school. What we ran a quick survey a few months ago. 40% of these kids never go back to school. And there is no boys, girls, whoever can go to work will drop out to go to work. And so now and then that generation loses. When education is lost, that generation has lost its opportunities in life. And so now we are, obsessing about how can we, while they go to work, how can we keep their education also going on the sidelines? So if we are working with several people, several ideas, and the challenge is if these kids were in one place and they have to come for an evening class, that is easily done. But they are scattered across the countryside, and to have one child in one village and one child in another village 60, 80 kilometers, it is very difficult. And so our challenge is how do we provide for education while the kids are in their homes working and earning and keeping the food available on the plate the next day. The third thing that we are obsessing about is ensuring continuity. Over the years, we have done what we have done because of what we believed in. Now, in due course, we will all move on, and there will be another bunch of people working there. And we have raised expectations in the community. We have built liaisons in the community. We work very closely. How do we keep all this active and continued? Problems will change. So will solutions to these problems. The basic core values of patient-centeredness, pro-poor care, evidence-based medicine, teamwork, these things will not change. And so we're now trying to learn to create leadership amongst my colleagues to create leadership at all levels, from the top doctor to the cleaning personnel. I want our cleaning personnel to be able to say that when asked, what are they doing? Instead of saying I am a cleaning personnel, I want them to be able to say that they are helping in treating cancers. And so how do we create this leadership in the staff? And how do we teach them? So all of us sat down in the room and wrote down what our core values are. Then we published them. Then we wrote our mission statement. All of us sat and wrote a anthem for the hospital. But how do we continue this for future generations? And how do we teach them to teach these values ahead to the next generation that joins? So these are things that we are grappling with. And I take this opportunity to invite all of you to visit us in Silchar and help us handle these problems a little better. Thank you very much.
Hello, friends. If I may just interject, I requested for 2 minutes. During the Hospital Tech 2025, this is the first time the organizing committee has actually introduced this 3 recognitions for the first time for institutional, I won't say it awards, it's a recognition. It's a recognition because it's an honor for the committee, for the organization, that 3 of these leaders have actually agreed to spare their time, travel literally hundreds of kilometers, some of them actually senior citizens, by very difficult mode of communication, because the place where they're actually working is pretty far from the normal day-to-day society. Sometimes the flights are not available, etc. Ravi, who spoke just now, is a good friend, colleague of mine from, he's an ex-Tata Hospital. He could have been a consultant in the city of Mumbai. But it's a drive for all the 3 of these. These are society. These are society's captains of the society. These are the people who actually show leadership, what service can be. And I think not only claps, but I think all the 3 of them deserve standing ovation. I think, thank you very much, sir. We are most obliged. तुम्ही इथं येऊन आमच्यावर खरोखर उपकार केलेले आहेत आणि त्याच्याबद्दल खूप धन्यवाद. The recognition is for 2 reasons. One is, of course, for us to know their work. Ravi has already spoken about what he's doing. He's not from Silchar. He's not from Assam. He just went there, and that whole idea actually captivated his mind, and then he went into service. And the same is the story with the other 2 people. The reason why we have identified them and requested them to be present here is because we have captains of the industry here, captains of hospitals, captains of industry, automation, artificial intelligence, pharmacy, everybody is here. And you are looking at outlets, how best can I express myself? And these are the people who actually need all the kind of an assistance that they actually can lead, so that whatever work they're doing can become larger, make it bigger. So I would suggest that watch them very carefully. Think how you can be of assistance to them. Extend this thing. They've got very strong wings. All that we need to actually do is fill air under their wings, and they can actually fly higher. They can lead us much more, and they can actually become examples of further followers in the society. So thank you very much, and we are most obliged.
Thank you so much, Dr. Deshpande. As rightly quoted by Deshpande ji, we have grown up listening to the inspiring stories of these stalwarts, and now we are, as professors, teach it to our students. Now we invite the next pioneer of community healthcare, whose work has touched millions and whose name is synonymous with reform and compassion, the very remarkable Dr. Abhay Bang, the founder of Society for Education, Action and Research in Community Health, Gadchiroli. Sir, can we please have you here on the stage? I would request you to shower your pearls of wisdom on the audience.
Friends, first let me thank CII and especially Dr. Deshpande for inviting us, three of us here, who don't really very frequently visit Mumbai, but because of your appreciation and love and this selection for award, we are here. The honor is for Rani, my wife and me, but unfortunately Rani, because of her health problem, has not been able to come. Since the theme of this meeting is healthcare roadmap for Vikasit Bharat, I thought I'll begin with something which happened 40 years ago. We had freshly come back from the US, and in Delhi, I was introduced to an old man who interestingly looked little like Mahatma Gandhi. And probably he was told sufficiently about me, so he sort of took my cross-examination. So he said, Abhay, I hear that you grew up in Mahatma Gandhi's ashram. I said, yes. I hear that you had walked with Vinoba Bhave. I said, yes. I heard that you did your MD and then MPH in the US. I said, yes. I was preparing for now some bombshell to come. So he kept on praising me and then finally asked me a question. Tell me, what is the Indian definition of health? Never heard. I blurted out the WHO definition. He said, that's a Western definition. Tell me the Indian definition. I had to concede the defeat. He asked, what is health called in Indian languages? Sanskrit mein, Hindi mein kya kehta hai? मैंने कहा स्वस्थ. That is the Indian definition of health. जो स्व में स्थित है वो स्वस्थ है. The word for health in India, it has inbuilt definition that health is independence. Health is freedom. Health is not dependence on doctors, on hospitals, on diagnostics, on subsidies, on insurance companies. Health is self-sufficiency. Health is... Now, incidentally, I said in the beginning, he looked little like Mahatma Gandhi because he was the very grandson of Mahatma Gandhi, Professor Ramchandra Gandhi. So I heard this Indian definition of health as if directly from Mahatma Gandhi's voice. For me, it was a eureka moment. All that I had learned in medical college and subsequently in the US was disease-oriented, healthcare system-oriented, and here was a very different vision about health, different meaning of health. Can we impart the power to remain healthy to the people of India? And so when we went to Gadchiroli nearly 40 years ago, where my friend Prakash and Manda also had been there for a few years earlier, we started search for what could be the healthcare model for rural and tribal people in India. Gadchiroli is a remote place, very poor. People in Mumbai usually know Gadchiroli either for forest or for mosquitoes or for tiger stories or for Naxalites. Gadchiroli is all of this, but Gadchiroli also has 1.2 million population, half of which is tribal, living in remote, inaccessible areas, living nearly 1,000 years backward in the knowledge and science sphere. How do we provide them healthcare? And the challenge of Gadchiroli was not only challenge of Gadchiroli. There are 11 crore tribal people in India. I was later on chairman of the National Expert Committee on Tribal Health of Government of India. Now, these 11 crore tribal people living in remote parts of India, or nearly 140 crore people in India who live in different 1 million villages and towns and slums, how do we provide them healthcare? So when we went to Gadchiroli, we asked the tribal people, we called together as a tribal health assembly, and we asked them, why don't you go to the government hospitals in cities? So tribal said, we are afraid. What are you afraid of? They said, multi-story building. वो buildings ऐसी होती हैं कि हम उसमें खो जाते हैं. And then what else? They said the patient is admitted in the ward, but relatives are asked to go and come back between 3 to 6. Now, we don't have wristwatches. How can we come back? So the relatives go back to village, so patient also goes back to village. So this separation of patient from relatives. Third thing they said, these doctors and nurses are wrapped in some white cloth, apron. So we said, what is the problem with that? They said, we wrap dead bodies in white shroud. These doctors are already wrapped in white shroud. How can they save anybody? And then finally, they confided that there is no God in the hospital. Doctors consider themselves to be the gods, but they are not God. There is no God in the hospital, and without God, there cannot be any healing, so we just don't go to hospital. So keeping these fears in their mind, we designed a new kind of hospital, constructed a hospital of huts. A hospital, tribal-friendly hospital, which will look like a tribal village and less like a hospital. So it's a hospital of huts, matching with the tribal Gond culture in Gadchiroli. And then, finally, we also erected a temple of their goddess at the gate itself and named our hospital Ma Danteshwari Davakhana, their highest goddess. Design of hospital, culture of hospital has to be what people expect. Not people should be afraid of our design and our culture, but they should feel homely there. Another issue which came up in the Tribal Health Assembly, we asked, what are the topic on which you want us to do research? And tribal people sat together for 2 days and they finally gave us 6 problems. They said, if you can solve these 6 problems, please do. Now, I'll not go through the entire list, but I must tell you that those 6 problems provided us subsequent 35 years research agenda. One of the problem was child mortality. हमारे बच्चे मर जाते हैं, आप कुछ कर सकते हैं? So in 1 lakh population, we established birth and death registry. And in the first year, we assessed that the infant mortality rate was 121. And why were children dying? The major causes of death were A, childhood pneumonia, and second was newborn mortality. Now, antibiotics were discovered nearly 50 years ago, but in those remote villages of India, when a child falls sick with pneumonia, it is panting for air, 1 dose of antibiotic will start the process towards relief. But how would diagnosis be made? There are no X-ray machines, there are no stethoscopes, there are no doctors. So I designed a simple instrument which I call breath counter, in which if a child has cough, you count the respiratory rate, and if respiratory rate is more than 50 for infant and more than 60 for a neonate, it is pneumonia. This was based on the research done by an Australian pediatrician in Papua New Guinea, the respiratory rate criteria. Using this simple equipment, which even an illiterate woman could use, without knowing what she is counting, how much she is counting, she couldn't count till 50 or 60, but still she could diagnose pneumonia, and her diagnosis matched 82% with the diagnosis of doctor with Littmann stethoscope. So this transfer of power, medical power, knowledge power, medical diagnosis power, and power of treating childhood pneumonia in the village itself, we conducted a field trial, and this simple method of community-based management of pneumonia by community health worker reduced infant mortality rate from 121 to 80. And this became model which was adopted subsequently by the global ARI control program and currently being used in 80 countries. Then the remaining mortality was among the neonates, the most fragile human beings that we can imagine, very delicate. And at that time, 95% of deliveries in Gadchiroli used to occur at home deliveries. And in those dark rooms, home deliveries where nobody else was permitted to enter except for Dai, half of India was being born. And it either survived or it died in those dark home delivery rooms. So how to take newborn care, medical care there? Newborns and those mothers were unable to come to hospital. So again, we turned the medical science upside down and trained village women, one per village, to become a village level neonatologist. And this method of providing newborn care right at home in that home delivery room, we called it home-based newborn care. A rigorous field trial was conducted. And in those 39 intervention villages compared to 47 control villages, we found that within 3 years, the newborn mortality rate reduced by 62%. And the infant mortality, which was earlier 121 with pneumonia treatment, came down to 80, and now with home-based newborn care, it came down to 30. This study was published in the Lancet in 1999. And not only it was published, but subsequently the Lancet selected is one of the vintage papers published in the 180 years history of the Lancet. So this model was adopted internationally. As I said, it's being used currently in several countries in Africa, in Asia, in South America. Government of India adopted this model and asked us to train 1 million ASHAs, community health workers in India. Through a 3-stage process, we trained 1 million ASHAs to deliver home-based newborn care in rural areas. Now, every year, 15 million rural neonates receive home-based newborn care. And this very rapidly reduced infant mortality rate. When in 2004, we had assessed that the cost of providing home-based newborn care per neonate was $5, and cost per life saved was $125. One of the cheapest intervention to save lives. The way this research is conducted, we like to call it research with the people. There is a research when we conduct research on the people. Most of us, clinicians, biomedical scientists, we conduct research on the people. The next step, research for the people. And this we call research with the people, in which people are involved in identifying the problem. People are empowered to deliver effective solution. It is tested through rigorous field trials, and with the scientific backing, it then scales up from Gadchiroli to global. Friends, our challenge is, how do we provide healthcare to 140 crore people in India when the cost of healthcare per capita in India is nearly $60? But we are imitating American model where the cost of per capita healthcare is $11,000. With $60 in your pocket, we want to imitate American healthcare model, which is financially impossible. And worse, as Dr. Jha mentioned, the lifespan is increasing, and increasingly we are facing more and more non-communicable diseases, which are lifestyle related, which are incurable, which need high technology, high cost. So challenge for all of us for healthcare roadmap for India is, how do we prevent illnesses? How do we make people swastha? Not inviting more and more patients to hospitals or to doctors, but how do we make people empowered so that they don't have to come to hospitals and doctors? That is something which we are trying to explore. That's why my organization is called Search. And the headquarter, our village that we have constructed is called Shodhagram. Problems are not over. One generation of problem of malnutrition, mortality, malaria are getting controlled, but the new problem of hypertension, diabetes, stroke, heart disease, cancer, and mental health problems are emerging. With this approach of research with the people, we are now trying to understand first, and then if possible, develop models of healthcare which would address these as well. When you honor us, you don't honor Rani or me. Actually, you honor an approach, a path. And thank you so much for honoring us.
Thank you so much, sir, for your inspiring words and for reminding us that the real transformation actually starts and happens at the grassroots level. Your vision will light path for all of us even after the event gets over. Now, I take the honor of inviting a living embodiment of service and sacrifice, a humanitarian who dedicated his entire life to the upliftment of tribal communities, the legendary Dr. Prakash Baba Amteji, the medical director of Lok Biradri Prakalp and a Padma Shri awardee. So we request you to please join us on stage. Prakash ji, we would request you to please join us on stage and shower your pearls of wisdom on the audience. I also request Dr. Mandakini Amte ji to please join us on the stage. You are an inspiration for many more generations to come. Would you like to speak something to the audience? We would request sir to please speak a few words to the audience. Yes, sir.
हिंदी
Please.
में बोलता हूँ।
Yes.
नमस्कार बहुत बहुत धन्यवाद पर्टिकुलरली डॉक्टर देशपांडे जी कि आप हमें मौका दिया आपके साथ इंटरेक्शन करने के लिए। वैसा जो हिस्ट्री देखा जाए तो माय वर्स्ट क्रेडिट गोज टू बाबा आमटे। शायद लोगों ने सुना होगा बाबा काम लेप्रेसी के बारे में, ही वाज मोर नोन फॉर लेप्रेसी, लेकिन बहुत कुछ किया उन्होंने। जब देखा उन्होंने कि उनके दो बेटे लेप्रेसी कॉलोनी में रहते हुए MBBS कर रहे थे और फाइनल एग्जाम दिसंबर 70, उसका रिजल्ट आने का था, इसलिए वी आर आनंदवन जाके रुके थे। तो ही सडनली सेड लेट अस गो फॉर अ पिकनिक, अभी आपको छुट्टी भी है। दिसंबर 70 ही टुक अस टू अमरागढ़, जिसका नाम कभी सुना नहीं था। पता नहीं उन्होंने कैसा सुना होगा, शायद ही बिकॉज व्हेन ही वाज द सन ऑफ ए लैंडलॉर्ड तो शिकार के लिए उधर गए होंगे, बहुत ही घना जंगल है, तो शायद वो इम्प्रेशन उनके दिमाग में होगा। लेकिन त्रिवेणी संगम है, 3 नदी का संगम है, बड़ा अच्छा है। तो हमारे 4 व्हील का गाड़ी था पिकअप वैन, उसमें हम लोगों को फैमिली ट्रिप 250 किलोमीटर को 2 दिन लगे, रास्ते ही नहीं थे, नदी के थ्रू जाना, नाले बहुत थे। और वहाँ संगम में मुकाम किया, बहुत ठंड थी, तो वी हैड ऑल स्वेटर्स एंड शॉल, और बहुत बड़ा फायर लगा के बैठे। तो सुबह हुई तो इतना दूर आया तो चलो आजू बाजू का एरिया देखे, तो एक ट्राइबल विलेज में ले गए। अब गाड़ी में से हम लोग जैसे उतरे और गाड़ी का आवाज़ सुन के ट्राइबल अपने अपने झोपड़ी से बाहर आ गए, और वो देखने लगे कि ये कौन लोग है, कपड़े पहने, स्वेटर से शॉल है, और फिर किस लिए आए होंगे, सस्पिशन। हम लोग से रुके और फिर बाद में उनसे कुछ थोड़ा सा बात करने का सोचा, तो धीरे धीरे करके सब जंगल में भाग गए। एक बेसिक डिफरेंस था, उस समय 70 की बात है, इतने ठंड में everybody was more or less दिगंबर, just a loin cloth for adults बच्चे तो पूरे नंगे थे। तो लेकिन डर का कारण नहीं पाया। दूसरे गांव में ले गए, तीसरे गांव में ले गए, कोई रुकने को तैयार नहीं। वापिस हमारा मुकाम वो संगम पे था, बड़ा फायर लगा था। अच्छा, तब 70 तक हम दोनों भाई एक ही साथ में थे एमबीबीएस करने के। दोनों ने डिसाइड किया था कि बाबा का वर्क में हम लोग ज्वाइन होंगे, आनंदवन लेप्रोसी का कॉलोनी। लेकिन वो देखने के बाद सिर्फ बाबा के जो इम्प्रेशन जो देखा था, वो तो हर आदमी सोच रहा था वहां पे अंगार के पास बैठ के कि किताब में तो ट्राइबल के बारे में पढ़ा है, तो वो जंगल में रहते, कंदमूल और शिकार करके जो अपने गुजारा करते हैं। और यहाँ तो उनके मन में डर भी है। मालन्यूट्रिशन तो नेचुरली था, इतने सालों से वो जंगल में रहते हैं तो कुछ खाने के लिए तो कम होते गया है। तो स्वयं बाबा सेड हो, तो उन्होंने देखा कि इनके ऊपर असर हो गया है, तो बोले कि आप दोनों अब डॉक्टर हो रहे हैं और आपने अपने आनंदवन में रहने का निर्णय भी ले लिया है। मुझे ऐसा लगता है कि ये भी अपने भाई बंद है, इनके लिए कुछ करे। तो सडनली आई रियलाइज्ड, मतलब उनका इंटेंशन ऑफ इस पिकनिक। मैंने बोला कि बाबा आप अभी 60 की तरफ जा रहे हैं और इतनी डिफिकल्ट एरिया में काम करे, उससे मैं तो 22 साल का हूं। आप यदि काम शुरू करें तो उसकी जिम्मेदारी मैं लूंगा। तो दैट वाज पिकनिक वाज अ टर्निंग पॉइंट इन माय लाइफ। जैसे कि ये प्रोजेक्ट का शुरुआत ये पिकनिक से शुरू हुआ, और मैं अकेला था, आपका मंदाकिनी नहीं थी तब, हम दोनों भाई। और फिर हम लोग वापस आए, हमारे रिजल्ट आ गए, इंटर्नशिप शुरू हुआ। तो बाबा बोले गवर्नमेंट ऑफ महाराष्ट्र को लिखो कि आप यहाँ काम करने के लिए जगह दो। एज एवरीबडी नोज, आपका संबंध आया होगा गवर्नमेंट में, तो फॉलोअप नहीं रहा तो उसका जवाब नहीं मिलता। इंटर्नशिप खत्म हो गई, जवाब नहीं आया। फिर थोड़ा पोस्ट ग्रेजुएट करने के लिए गए, अभी जब तक जमीन नहीं मिलती तो काम कैसा करें। तो वो भी सब मतलब जो होता है अच्छे के लिए होता है। गवर्नमेंट का मैं शुक्रगुजार हूँ, उन्होंने देरी की इसलिए मुझे मंदाकिनी से मुलाकात हुई। वो नागपुर की है, उससे कोई कभी सोशल सर्विस का बैकग्राउंड नहीं, कभी कुछ देखा नहीं था। लेकिन वहाँ पर अनस्थीसिया और सर्जरी में काम करते करते हम दोनों की पहचान हो गई। पहचान का प्यार में बदलाव हुआ, देखते देखते चर्चा होने लगी लोगों में। बाबा के पास कंप्लेंट गई कि आपका बेटा लड़की को लेकर घूम रहा है। तो बाबा ने बुला लिया मंदाकिनी को आनंदवन। तब तक आनंदवन अच्छा हुआ था, मतलब ये डेवलप विलेज जैसा था, प्रेजुडिस कम हुआ था लेप्रोसी के बारे में। तो बाबा ने पूछा उसका, तो आप लोगों का क्या है? तो मैंने बोले, मैं शब्द दिया उसको, जबान दिए शादी करने के लिए, लेकिन वो कहाँ जाना है मालूम है नहीं। तो बोले जाओ, कहीं जंगल में काम करने वाला है गढ़चिरौली के। गढ़चिरौली नहीं था तब, चंद्रपुरी था वो। तो तुरंत बाबा ने निर्णय लिया, थोड़ा थोड़ा बोला था, 5 मिनट। तो बाबा ने तुरंत शादी करवा दी 72 में। मतलब पुराने लोग वैसे प्रैक्टिकल होते हैं। माँ की इच्छा थी कि विकास बड़ा भाई है, उसकी शादी पहले हो, तो उसकी शादी में देर लगता तो शायद इसका निर्णय बदल सकता था। तो इसलिए बाबा ने हमारी शादी 72 में करवा दी। और फिर 73 में जगह मिली गवर्नमेंट ऑफ महाराष्ट्र से, हेमल का साहब हमरागढ़ के थोड़ा 2 किलोमीटर पहले। तो मैं एमएस कर रहा था जनरल सर्जरी में, वो छोड़ दिया। एनेस्थीसिया का डिप्लोमा इसने पूरा करके वो लेक्चरशिप कर रही थी, और वहाँ जाके बैठ गए। तो दिस इज द हिस्ट्री। हेमल का साहब ट्राइबल के बारे में हम लोग पहले कभी सोचा नहीं था, किताब में पढ़ा था उतना ही था। फिर यहाँ आने के बाद एक्सपीरियंस कुछ नहीं, क्या करें। सबसे बड़ा प्रॉब्लम था लैंग्वेज का, और दूसरा प्रॉब्लम था विश्वास। विश्वास कैसे आप पैदा करें? लोगों के पास गए तो लोग बातें नहीं करते या भाग जाते। फिर वो फ्रस्ट्रेटिंग टाइम था, मतलब ये पेशेंस टेस्ट कर रहे थे हमारा। लेकिन जब बाद में देखा कि उनकी परंपराएं क्या है, तो हर गांव में वो पुजारी रहता है, मांत्रिक। तो बीमारी के लिए उसके पास इलाज जो होता है मंत्र तंत्र हर्बल मेडिसिन है, और बलि, समटाइम्स ह्यूमन सेक्रीफाइस, कभी कभी वो नर बलि भी करते थे। और इसके बावजूद यदि पेशेंट ठीक नहीं हुआ तो वापिस भेज देते, बोले भगवान के भरोसे। तो ऐसे भगवान के भरोसे जो पेशेंट उन्होंने छोड़े थे, वापिस किए थे, तो वो पड़े रहते थे अपने घर के सामने, तो हम तो घूमते ही थे। तो ऐसे कुछ पेशेंट रिलेटिव्स को मैंने बोला कि अभी ये तो मरने वाला है, आपके सब तो आपके उपाय तो हो गए, तो इसको क्यों नहीं लाते हमारे यहाँ हेमल कसा में झाड़ के नीचे। हमने अस्पताल, ये नाम भी नहीं मालूम था, लेकिन हम लोग कुछ करेंगे, तो खटिया पे डाल के लेके आए। पहला पेशेंट अनकॉन्शियस था, कभी पता नहीं डायग्नोस कैसा करे, लैब नहीं है, बिजली तो 22 साल नहीं थी, मतलब तब तो कुछ भी नहीं था, लैंग्वेज का भी प्रॉब्लम था। लेकिन हम लोग डिबेट करते थे आपस में, किताबें पढ़ो, अनकॉन्शियस हुआ होगा, सिम्टम्स से क्या क्या हो सकता है। तो सोचा कि ये शायद दिमाग का मलेरिया होगा। तो हम और हमारे साथ कार्यकर्ता थे, बाबा की प्रेरणा से आए हुए, तो वो रात दिन उसके मतलब ऑब्जर्वेशन कर रहे थे, और उसको क्विनिन और ये चालू किया, ग्लूकोज। और तीसरे दिन उन्होंने आँख खोली, तो हम लोगों को बड़ी खुशी हो गई कि अपना डायग्नोसिस बराबर था, लाइन ऑफ ट्रीटमेंट ठीक थी। और 5वें दिन बस वो तो खाने लगा और ठीक हुआ, अपने कटिया कंधे पे लेके पैदल गया। तो ये जो टर्निंग पॉइंट उनके जीवन में था, ये जो आदमी मरने वाला था, इसको हेमलकसा में जगह कहीं लिया, झाड़ के नीचे ले गए, लेकिन उन्होंने कुछ किया, इंजेक्शन वगैरह लगाया, तो ठीक हो गया। उसके बाद में माउथ टू माउथ पब्लिसिटी होते, बहुत बड़ा एरिया है वो, और बहुत सारे फिर केसेस आने लगी। हमको बहुत चैलेंजिंग था, एक्सपीरियंस नहीं था, और हर किस्म के पेशेंट आते थे। फ्रैक्चर का पेशेंट आया तो डायग्नोस कैसे करें, एक्सरे नहीं है, स्वेलिंग तो दिखता था, तो उसके ऊपर नीचे पकड़ के हिला के देखो, फ्रैक्चर हुआ तो यू कुड फील द फ्रिक्शन, तो डायग्नोसिस कंफर्म होता था। फिर वो सीधा करके प्लास्टर ऑफ पेरिस से उसको बांध दिया तो ठीक हो जाता। मतलब हर पेशेंट के लिए कुछ ना कुछ इलाज, क्योंकि सिटी में आना मुश्किल था, कट ऑफ होता था, कपड़े नहीं थे उनके पास, पैसा नहीं था, लैंग्वेज नहीं थी, तो इधर आने का सवाल ही नहीं। जो कुछ करना है वो यहाँ पुजारी करे, पुजारी ने नहीं किया तो आप करो, नहीं किया तो भगवान को प्यारे हो गए। तो इस तरह से मतलब फायदा होने का, पेशेंट का प्रमाण बढ़ते गया, तो वो पब्लिसिटी हो जाएगी अपने आप, माउथ टू माउथ। तो करीबन 150 किलोमीटर का एरिया है, छत्तीसगढ़ भी नज़दीक है, बस्तर का एरिया, नीचे वो तेलंगाना था, तो लोग पैदल आते थे या खटिया पे उठा के लगे, डिपेंडिंग ऑन द। और फिर डिलीवरी के लिए आओ, फ्रैक्चर के लिए आया। एनिमल बाइट्स, बेयर बाइट बहुत सीवियर होता है, वो तो जान नहीं लेता है, लेकिन अटैक इन डिफेंस, यूजुअली स्कल के ऊपर हमला करते हैं। फिर उसको खटिया पे डाल के लाओ, फिर उसको स्टिचेस देना, फिर साफ करो, ये करो। एंटीबायोटिक में तो वी यूज पेनिसिलिन इन मिलियंस। पेनिसिलिन चीप था काफ़ी, सल्फा में सल्फा डाइजिन और बाद में सेफ्ट्रान, वर्जिन एरिया था, काफ़ी इफेक्टिव होते थे drugs। तो बहुत सारे पेशेंट ठीक होते गए। लेकिन जैसा ये एक बेयर बेड का एक पेशेंट था, जिसने मुझे भी मतलब भारत की परिस्थिति क्या है इसका असल में अनुभव आया। बहुत बुरी तरह से घायल किया था, स्काल्प उसका नीचे पीछे लटक रहा था, आंखें अंधे हो गई थी, और उसको फिर स्टिचेस दिया। तब तो एनेस्थीसिया भी नहीं था, विदाउट एनेस्थीसिया स्टिचेस दिया। वो टॉलरेंस वॉज ट्रिमेंडस, पेनिसिलिन दिया, ठीक हो गया, हाथ पकड़ के पैदल चला गया। 1 साल के बाद उस गाँव के लोग आए, 60 किलोमीटर दूर था, तो आउट ऑफ क्यूरियोसिटी पूछा कि ये पेशेंट कैसा है, लास्ट ईयर जो बेयर बाइटर, तो बोले मर गया। इतने भरे भयानक हमले में वो जिंदा बच गया था, अभी कैसा मर रहा था? बोले वो अंधा था, इसलिए वो खुद का खाना ढूंढने के लिए नहीं जा सकता था, तो इसीलिए ये धीरे धीरे दुबला हुआ और मर गया। तो ये मतलब ये बहुत ही इंडिपेंडेंस के बाद में आदमी भूख के कारण मर गया। तो मैंने सोचा अभी कैटरेक्ट के पेशेंट गांव गांव में होते हैं, जब तक दिखता है तब जंगल में जाए, नहीं दिखता है तो अल्लाह को प्यारे। तो कैटरेक्ट की सर्जरी क्यों ना करें? तो पुराने टाइम में था एनग्राफिक नाइफ से कॉर्निया काटो, लेंस निकाल दो। नागपुर से इंस्ट्रूमेंट्स लेके आए, किताब लेके आए, एक कंपेयर को टेम्पररी ऑपरेशन थिएटर बनाया, और पहला ऑपरेशन, सब लोग टेंशन में थे। स्टेप बाय स्टेप ऑपरेशन किया। नेक्स्ट डे फिर ड्रेसिंग खोला तो आईज वर क्लियर, शी कुर्सी लेडी थी, तो बड़ा अच्छा लगा कि यार उसको फिर नई जिंदगी मिल सकती है, अभी जंगल में जाके फिर अपना खाना खुद ढूंढ सकती थी। और 10 दिन के बाद उसमें +10 का वो चश्मा होता है, 10 नंबर का, वो लगा के नीचे लंगोटी और ऊपर चश्मा, तो वो पब्लिसिटी ऐसी होती थी कि हाँ ये अंधे का भी इलाज होता है। तो जैसे आते रहे तो ऐसा करते गए। उसमें कोई हर तरह के पेशेंट को ना तो नहीं कर सकते थे हम, नहीं कह सकते थे, लेकिन विश्वास से लोग आते थे तो कुछ ना कुछ करो, नहीं दुरुस्त कर दे, कम से कम पेन रिलीफ तो कर सकते थे। तो इस करने के बाद में हमको, हमारे वॉलंटियर सर, हम दोनों को, हमको ऐसा लगा कि बहुत सारे डॉक्टर कहते कि खाना खाने के बाद दवाई लो, और यहाँ खाने के लिए अनाज नहीं, तो क्यों ना इनको फार्मिंग सिखाएं। ट्राइबल की स्कीम्स बहुत ज़्यादा थी, यहाँ तक पहुँचती नहीं थी, पैसा खर्चा होता था, तो एजुकेशन नहीं था। तो हमारे वॉलंटियर बोले कि वी स्टार्ट स्कूल फॉर दैट। उसके लिए भी विरोध हुआ पहले, ये बच्चे हमको कहाँ ले जा रहे हैं, अपने घर में रखेंगे, वापस नहीं करेंगे। मैंने बोला आप अस्पताल में आने के लिए भी डर रहे थे, अभी एक मौका हमें और दीजिए, आपको शिक्षित करेंगे, अच्छा लगा तो रखो, नहीं तो ले जाओ। तो 25 बच्चे से स्टार्ट हुआ, 8-10 तो भाग गए, उनको अच्छा नहीं लगा डिसिप्लिन लाइफ, लेकिन उससे एक स्कूल बढ़ते गया। जिनको अच्छा लगा वो पब्लिसिटी करते गए, तो करते करते आज मुझे कहने में बड़ा भाई खुशी हो रही थी, करीबन 52 साल हो, स्कूल से हजारों बच्चे शिक्षित हुए, उनमें से कुछ डॉक्टर्स है, पोस्ट ग्रेजुएट डॉक्टर्स है। जहाँ एजुकेशन बिल्कुल नहीं था, वहाँ मौका मिलने से हर फील्ड में है, डॉक्टर है, वकील हुए, टीचर्स भी कब से बहुत सारे हुए। आईआईटी में किसी को एडमिशन मिली, तो हमारे जैसे टीम वर्क बेसिकली, तो ये सब वॉलंटियर्स ने मिलके काम करते करते विदाउट प्लानिंग, विदाउट फंडिंग काम शुरू होते गए। स्कूल को भी मान्यता 10 साल के बाद मिली, और वो भी डॉक्टर जिचकार मंत्री थे, वो सरप्राइज विजिट के लिए आए थे, पिकनिक के लिए, और उन्होंने देखा कि यहाँ तो इतने सारे बच्चे हैं, अस्पताल है। ये वॉज फ्रॉम आवर मेडिकल कॉलेज, ओरिजिनली एमबीबीएस डिग्री थी उनकी, बाद में बहुत सारी डिग्रियाँ दी है। तो उनको शर्म आ गई, तो भाई इतने सारे काम कर रहे हैं और इसको रिकॉग्निशन नहीं है गवर्नमेंट को, बिकॉज ही वॉज द मिनिस्टर, तो उन्होंने बम्बई से रिकॉग्निशन भेजा। तो उसके बाद में नाउ स्कूल इज रिकॉग्नाइज, थोड़ा सा ग्रांट भी मिलता है, टीचर सैलरी मिलती है। लेकिन फिर हमारे बच्चे वहीं पे पढ़े इनिशियली, फिर बाद में एक बड़ा एमबीबीएस हुआ, दूसरा इंजीनियर है, दोनों ने खुद होकर निर्णय लिया कि हम आपके साथ में काम करेंगे। तो बहुत अच्छा लगा कि अपना रिस्पॉन्सिबिलिटी धीरे धीरे उनके कंधे पे सौंप दिया पूरा, और हम दोनों मुक्त हो गए। उनके पार्टनर भी अच्छे मिले, दोनों सिटी में। तो ये एक तकदीर है कि एक तो गोवा की हमारी बहू गायनेकोलॉजिस्ट है, तब तक हम गायनेकोलॉजी की डिलीवरी करते थे, और कभी कभी डिलीवरी नहीं कर पाते थे, डिस्ट्रक्टिव सर्जरी करते थे, बच्चे को काट को निकालो, पुराने ज़माने में जो करते। लेकिन उसके 2003 में बेटी की शादी हो गई, अब तब से डिफिकल्ट लेबर या सिजेरियन की ज़रूरत पड़े तो मंदाकिनी अनेस्थीसिया देती है, और वो सिजेरियन करती है तो दोनों की जान बच जाती है। तो ये जो है रिमोट एरिया में ये भी एक फैसिलिटी, विदाउट प्लानिंग बच्चे की शादी गायनेकोलॉजिस्ट से हुई, वो विचार करके आई। और दूसरी बहू है, वो पूना से है, एजुकेशन में काफ़ी इंटरेस्ट है, तो उसने काफ़ी इम्प्रूव किया एजुकेशन। वहाँ नीट के क्लासेस शुरू हुई, वॉलंटियर्स को अपील किया, वॉलंटियर्स वहाँ पे है, नीट के क्लासेस दे रहे, हर साल 3-4 बच्चों को एमबीबीएस में एडमिशन, बाकी कोई नर्सिंग में जा रही है या कोई बीएमएस। तो इस तरह से मतलब बच्चों का टैलेंट, जिनको मौका नहीं था, हम लोगों ने सिर्फ मौका दिया, मेहनत उन्होंने किया। तो हम लोग ऐसे बोलते कि क्या ये हेल्थ, एजुकेशन, फार्मिंग एंड अवेयरनेस अबाउट देयर राइट्स, और आखिरी में वो थोड़ा सा जिसके लिए मैं ज़्यादा मशहूर हूँ कि ये जानवर, जंगली जानवर, ये आदमी से अच्छे कैसे बर्ताव करते हैं, जिसमें लेपर्ड्स है, बेयर है, हाइनाज और नॉन हर्बीवोरस मतलब हिरन वगैरह जाति के, तो अपने पास कैसे आए? तो एनीथिंग दैट मूव्स दे यूज्ड टू किल एंड ईट। वहाँ जाते के बाद पता चला कि ये बंदर भी खाते हैं, ये चूहे भी खाते थे। रेड आइंस तो सुना होगा आपने, चटनी बनाते। तो वो बंदर का बच्चा एक दिन हमने देखा कि मरे हुए माँ को चिपका था, मरे हुए माँ को। तो उसको हमने रिक्वेस्ट किया कि इसको दे दो। तो बोले हमारे बच्चे क्या खाएंगे, मतलब हंगर इतना बड़ा प्रॉब्लम था। मैंने बोला बच्चे को खाने के लिए चावल दे दो। और वो बार्गेन करके बंदर का बच्चा लाया, और दैट इज हाउ दिस ऑर्फनेज स्टार्टेड, आर्मटेज एनिमल आर्क। तो बाद में पेशेंट जैसे आते रहे तो उनको हमने रिक्वेस्ट किया कि आप बच्चों को मत मारिए। तो नेक्स्ट टाइम ही वाज डियर फॉन एंड देन द लेपर्ड कब एंड बेयर कब। ऐसा करते करते 100 सवा 100 जानवर अपने घर में है। पहले तो वो घर में लिटरली घर में थे और नदी के घूमने आते थे एक साथ में, बेयर, लेपर्ड, कुत्ते। बाद में स्कूल स्टार्ट किया, बच्चे उस पर आते, एक्सीडेंट ना हो इसलिए उनके लिए केजेस बनाए। और वो लिमिटेड इंडिपेंडेंट उनको देता हूँ, खेत में ले जाता हूँ घुमाने के लिए जहाँ कोई स्ट्रेंजर्स ना हो। तो इस तरह से वो भी एक ऐसा अच्छा एक सेटिस्फैक्शन मिलता है कि आदमियों के लिए, 2 पाँव के जानवरों के लिए गए थे और सब जीव जंतु का प्यार पा सका। और और बाद में ये इधर उधर आप बुलाएंगे ये कभी सोचा नहीं था। पहले 30 साल तक हम बाहर नहीं गए कहीं। इंट्रोवर्ट, सोचिए हम लोग दोनों इंट्रोवर्ट है, बाबा बहुत बोलते थे, उसी की वजह से होगा शायद। हाँ, हम लोग बहुत कम बोलते थे। लेकिन एक बार बाहर निकाले, अमेरिका में पहले ऐसे इंटरव्यू के तौर पहले मीटिंग हुई और उसके बाद में सिलसिला चालू हुआ। अब तो खाली है, लोग बुलाते हैं और हम जाते हैं। लेकिन आने में तकलीफ होती है। अभी अभी 250 नागपुर आना है तो 7 घंटा ट्रैवल करना पड़ता है। एज 80 के करीब एज हो रही, तो उसकी तकलीफ होती है। फिर भी एक मज़ा आता है कि कॉलेज के बच्चों को इंटरेस्ट है, कहीं आईआईटी वाले बुलाते हैं, कहीं आईआईएम वाले बुलाते हैं। मेडिकल कॉलेजेस तो सब जाके उनको लगता है कि ये इतने साल काम कर रहे थे, इसके पीछे क्या प्रेरणा होगी, इतने मतलब इतना टिके रहना एक जगह पे। हम लोगों को वो एक सौभाग्य है कि दोनों बेटे बहू आ गए, जिम्मेदारी उन्होंने लिया है। हमने एक प्रिंसिपल रखा है कि जब तक वो पूछते नहीं तब तक सलाह नहीं देंगे। तो वो अच्छा चल रहा है। तो इस तरह से मैं फिर से आप लोगों का शुक्रगुजार हूँ कि सीआईआई ने हम लोगों को बुलाया, हमारा सत्कार कर रहे हैं। थैंक यू वेरी मच।
प्रकाश जी, मंदाकिनी जी, आपको मिलना, आपको सुनना, ये सच में हमारे लिए एक सपना था. Thank you to the entire CII team for giving all of us this opportunity to meet these legendary people. Now, I would request Dr. Ramakant Deshpande ji and Mr. Joy Chakraborty ji to please come to the stage for honoring the legendary people. I also request Mr. Krishnan to please join us on stage. And now, a beautiful moment when these legendary personalities are honored for their contribution to the society. Requesting the dignitaries to please do the honors. This felicitation for Prakash ji. Prakash ji. And I request the dignitaries to please honor Mandakini ji. इनका जीवन हम सबके लिए एक प्रेरणा है। अगर जो इन्होंने किया उसका 1% भी हम कर लें तो शायद ये हमारा सौभाग्य होगा। Thank you so much. I would request the dignitaries to please stay back on the stage, Deshpande ji and Krishnan ji. I now request Dr. Abhay Bangji to please join us on the stage for receiving the honor for the contributions that you have made to the society. A huge round of applause from every one of us.
Hello.
These are living inspiration to us.
I think, it's an honor on the organization to,
Very true, sir.
acknowledge
Very
their
true.
effort, all the three of them.
That they have come to,
Yes, yes,
honor us with their presence. Very true, sir. Yes, absolutely, absolutely. Their presence has made this event truly special. Can we please have the honor for Dr. Bang? In the times when we are only living for ourselves, these are the people living for others. Thank you, Abhayji. And now, I would request Dr. Ravi Kananji to please join us on stage and honor us with your presence and honor us by receiving this award from the dignitaries. These legendary people deserve a thunderous applause. So let us show the maximum.
There is a personal request that, the organizations which they have established, the work that they are doing is everything is in front of you. It is all known. It is always known by all of us. But, do see how we can actually be of assistance to all of them in their own work. And it's my own request, for example, the difficulties, what they have said, the problem that they are facing. If at all there's any way we can actually join them in their effort, we'll be doing very good thing, not only for us, ourselves, but for the society. So please take this up.
Thank you so much, sir. Let us now begin with the much awaited grand finale of the 4th CII Western Region Health Innovation Awards 2025. At the start, I want to thank this august gathering of healthcare experts, industry members, participants, and the jury for joining us for this award ceremony. And without further ado, I would like to call upon Mr. Krishnan V, the chairman of CII Western Region Health Innovation Awards and Chief Operating Officer Ramanan Wheel to present the welcome remarks. Over to you, sir.
The reason I'm running is I know we are way behind time, but good evening. More than anything else, today I feel privileged. I also feel a bit more energized. And the way I would put it is, I think this was a dream that we've been looking at about 3-4 years ago. And this year, when we began the thinking of awards, the first call I remember was made to Dr. Ramakant Deshpande, sir. India is not about what you see here in the coats and suits. There is a larger Bharat which is sitting out, and there are a lot of people like these who are serving the common man there. So what I take back from these lives is there is something called as Nishkam Seva. In Hindi, or how do I say, it's actually Sanskrit, Nishkam Seva, where you do Seva, don't expect things in return. And your karma is what will drive the world. I think these people are living legends who are teaching us the reason we are in healthcare. We are not here to only heal people, but make their lives so better that they don't need to come back. The way Dr. Bhang said is, they make themselves so independent that they are always healthy and they can only come back for advices. With that little emotional. Sorry about that speech, but I really feel energized. I think the awards this time is very different. You have already seen. I'm so happy to see such a packed house. With these luminaries, for the first time, we are looking at social leadership awards, and I'm glad all these people could make it. Feel blessed and बहुत बहुत धन्यवाद उसके लिए. We have about almost 40 participants who have taken in, participated in these awards. About almost 35 jury members who independently judge these awards. Their scores have been marked, and largely three parameters that we looked at in terms of how the project is, how are they making an impact, and are these projects scalable? Ultimately, something has to be scalable to make an impact. So these are largely the parameters. So what you'll see over the next 30, 35 odd minutes are the people the teams who have worked very hard in the commercial space. We also, standing on this dais, I would really appreciate if more people come in forward for this. We really want to set out a benchmark, let people know what healthcare is doing in India, because this is the motto of Vikasit Bharat. It is not alone us that we become greater, but we also take the world along with us. So thank you. With that much, I think I'll hand it over to you. Where is the MC? MC is busy. Yes, dear. I am done. Thank you. Come.
Thank you so much for your energetic words. So that has increased energy at this point of time in the evening. And now I would request Mr. Behram Kodaiji to please come on the stage and give the opening remarks. Thank you so much, sir, for joining us back on the stage. Respected, sir.
Thank you. Thank you so much. Good evening, ladies and gentlemen. It is both an honor and a privilege to stand before you today as the jury chairman of the 4th CII Western Region Health Innovation Awards, and also in my capacity as the Group CEO of Ruby Hall Clinic. Tonight, we celebrate not just the winners, but the spirit of innovation itself, a spirit that is shaping the future of healthcare in India. On behalf of the jury, I would like to extend my heartfelt congratulations to all the participants. Each of you has shown that groundbreaking ideas do not flourish in ivory towers, but thrive in the real world, in hospitals, community centers, startups, research labs, and sometimes in the simplest of observations that address the most pressing challenges of our times. I want to sincerely thank the Confederation of Indian Industry for providing a platform that recognizes and nurtures such path-breaking solutions. By doing so, you are fostering an ecosystem that encourages collaboration between healthcare providers, innovators, policymakers, and entrepreneurs. This is exactly the collaboration we need if we are to reimagine healthcare delivery, improve access, and transform patient outcomes across the country. To my fellow jury members, thank you for the rigor, the commitment, and the passion you brought into this process. Choosing among so many brilliant innovations and service providers was not easy, but it was really, really inspiring. And to the winners, while you take home an award tonight, remember that the true prize is the impact you create in improving lives and shaping the future of healthcare. And as I close, I am deeply optimistic. With the kind of talent, creativity, and commitment that we have witnessed here today, I truly believe that the future of healthcare in India is not just in safe hands, but in inspired and committed hands. Thank you once again. And once again, my warmest congratulations to everyone. Have a lovely evening, everyone. Thank you.
Thank you so much, sir. Before we move ahead, would like to make a special mention and gratitude to Padma Shri Dr. Ramakant Deshpande ji, Dr. Hardik Ajmera ji, and Mr. Joy Chakraborty ji for their guidance in the awards. I know the excitement is palpable. I'm sure you're eagerly waiting to know the outcome of the awards. But before we get to the awards, I would like to quickly take you through the happenings of the few past weeks. We invited applications in 9 categories of the awards pan-India. We received over 37 applications from healthcare facilities across the country. A stellar jury consisting of 30 healthcare experts scrutinized the shortlisted applications and scored the teams via virtual round of presentations based on the evaluation framework of 3 parameters: sustainability, impact, and initiative. The tabulated scores have been shared and verified by chair of the awards and chair of the jury. And the top 3 scoring teams in each of the 9 award categories will be felicitated today. So now we begin with the first category of awards for this evening. And to do the honors, I invite dignitaries on the stage, starting with Mr. Joy Chakravarti. So please join us on the stage. Dr. Ramakant Deshpande ji, I would request sir to join us on the stage for the award distribution ceremony. Dr. Hardik Ajmera ji, Mr. Krishnan V, Mr. Behram Kodai ji, and Ms. Vaishali Srivastav. We now start with the first category of awards, and the title for the awards is the Best Primary Care Initiative Award that celebrates healthcare organizations that have successfully implemented initiatives to improve primary care services. And the winners are, would start with the first runner-up. So the first runner-up is Ambuja Foundation. I would request the members from the team to kindly come up to the stage and receive the honors. The first runner-up is Ambuja Foundation. The awardees deserve an appreciation. Can we have a huge round of applause for them? And now, the winner in this category is Jubilant Bharatiya Foundation. Can we please have the representatives of this organization on the stage to receive the honors? Many, many congratulations. And now we move to our next category of award, which is Best Community or Patient Education Initiative. This category recognizes healthcare organizations, hospitals, or NGOs that have implemented exceptional programs aimed at educating patients or community about health-related topics. And the winners in these categories, I would start with the first runner-up. The first runner-up is JSW Sanjeevani Multi-Speciality Hospital. Many, many congratulations if we can have the representatives on the stage to receive the honors. And now we have winners in medium hospital category and then the winner in NGO category. So the winner in medium hospital category is Ankur Hospitals. Many, many congratulations. Please join us on stage to receive the honors. Huge encouragement to those who are bringing differences in the life of the people, improving the health of society. And now the winner in NGO category. The winner in NGO category is Sevankur Bharat. Can we please have them on the stage? Many, many congratulations. Many, many congratulations to the winners of this category. The next category that we have is Lifetime Achievement Award. This category recognizes the organizations that have made a lasting impact on healthcare sector through decades of excellence and service. And the winners of this category are, we'll start with the second runner-up. The second runner-up is Messina Hospital Trust. Many, many congratulations to the representatives who are making it to the stage. A beautiful moment of appreciation. Thank you so much. The first runner-up in this category is Dr. L.H. Hiranandani Hospital. Would request the representatives to please make it to the stage. Many, many congratulations to the winners. And now the winner in this category is Ruby Hall Clinic Hospitals, Pune. Many, many congratulations to the people who have given their services and are the true recipients of the award. Let's give a thunderous applause to this beautiful, joyous moment. That was a surprise for all of us. I was thinking why the recipient has not made it to the stage yet. Getting that the recipient is already there on the stage. We now move to the next category, which is the best med tech or health tech innovation. This category honors organizations, startups, or individuals that have introduced groundbreaking technological innovations in healthcare. And to do the honors, I also invite Mr. Thierry Van Helden and Mr. Nico to please join us on the stage for doing the honors. And now announcing the second runner-up in the category. The second runner-up is Motherhood Hospital. Requesting the representative to please quickly make it to the stage. And now the first runner-up goes to Access Health International. Many congratulations. Would request you to quickly make it to the stage. And now announcing the winner. There was a tie and hence we have two winner announcements now. So the first recipient is Medtronic, requesting the recipients to kindly make it to the stage. And the other winner in this category is Merrill Healthcare Private Limited. Many, many congratulations. Please make your way to the stage. Many, many congratulations. Now we move to the next category, which is the best academic institutions, which is given to those institutions in the healthcare sector that have set a benchmark in education. And the recipient of these awards are the NGO category. The first runner-up goes to Tech Mahindra Foundation. Congratulations, and please make it to the stage. Big round of applause for the recipients. And now the winner in this category. And the winner in this category is Life Supporters Institute of Health Sciences. Many, many congratulations to the winners. We request you to please make it to the stage for receiving the honor. And now, making announcements for the medium hospital category. The winner is Zen Multi-Speciality Hospital. Many, many congratulations to the winners. Next, we have with us the best patient experience category. And here we have two different categories, small hospital and large hospital. The winner in the small hospital category is Motherhood Hospital. Requesting the representatives to please make it to the stage. I think they're coming up on the stage for the second time to receive the honor. Many congratulations. And now making announcements for the large hospital category. The second runner-up goes to Dr. L.H. Hiranandani Hospital. Requesting the recipients to please make it to the stage again. The first runner-up in this category is Saifi Hospital. Can we please have the representatives on the stage to receive the award? Saifi Hospital being the first runner-up in the best patient experience category. I'm sure a very proud moment for Dr. Ajmera. Reliance International Hospital Foundation Hospital. Hello? Congratulations. And now the winner in this category is Sir H.N. Reliance Foundation Hospital. Many, many congratulations for this achievement. And now we move to the best healthcare digital initiative category that recognizes organization for digital innovations. And in the large hospital category, the winner is Yashoda Super Specialty Hospital, Kaushambi. Congratulations. And now we move to the small hospital and other category. The second runner-up goes to the R. Junjulwala Sankar Eye Hospital. Many, many congratulations. The first runner-up in this category is Mitai Healthcare Private Limited. Many, many congratulations to the recipients. And now, announcing the winner of this category. The winner of this category is Apex Kidney Care Private Limited. Many, many congratulations. Requesting the recipients to please make it to the stage. Many, many congratulations, sir. A very proud moment for the entire team present on the stage. Heartiest congratulations. And now we move to the next category, the Best Patient Safety Initiative category that acknowledges healthcare organizations that have implemented initiatives focusing on patient safety. In this category, in the large hospital category, the second runner-up goes to Aster CMI Hospital. Congratulations to the winners. The first runner-up in this category goes to Sahyadri Super Speciality Hospital, Deccan, Pune. Can we please have you on stage? Requesting the recipients to quickly make it to the stage for receiving the honors. And now, the winner in this category is Mehta Multi-Speciality Hospitals India Private Limited. Many, many congratulations. Can we please have the recipients on the stage? All right. Now we move on to the other category, and the best hospital in emerging cities is HCG Rajkot Hospitals LLP. Do we have the representatives from this organization amongst us? So we'll quickly move to the next category. I think the jury is expecting somebody to be there on the stage. Someone with Mr. Nishant, can we please have you on the stage to receive the honors? The recipient wanted the jury to themselves organize the name and invite them on the stage to receive the honors, I feel. And then now the next category that we move on to is Best Healthcare Delivery Initiative, which is given to innovative strategies or programs for improving delivery of healthcare services. And here, the Best Hospital in Emerging Cities award goes to Apollo Sage Hospitals, Bhopal. Heartiest congratulations. And here we have the recipient moving to the stage to receive the honors. Okay. And the Jury Appreciation Award goes to HN Reliance Foundation Hospital. In the best patient safety initiative category, for the other category, subcategory, the winner is Medtronic. Do we have anyone from the recipients? We would request them to please join us on the stage for receiving the honors. Let's appreciate the winners with a thunderous applause. Jahangir ka kahan naam? It is not there. Where is that? And now, the second runner-up for this category goes to, I will repeat the category again, the Best Healthcare Delivery Initiative. In this, the second runner-up is Jupiter Lifeline Hospitals Limited and Sahyadri Super Specialty Hospital, Hadapsar. Can we please have the recipients on the stage to receive the honor? This is Sahyadri? Sahyadri? Yeah. So we have the recipient Sahyadri for the honors. So here we have Sahyadri Super Specialty Hospital receiving the honors. Now, announcing the first runner-up in this category, it goes to Ruby Hall Clinic Hospitals, Pune. And we have the recipient on the stage. And now the winner in this category is, and the last award of the day. The winner in the category is PD Hinduja Hospital and Medical Research Center. Many, many congratulations. Congratulations to the winners, and I request the dignitaries to please stay back with us for a few more moments. We are about to wind up. It's a time we felicitate the dignitaries for their extraordinary contribution in CII initiatives. I would request Dr. Deshpande to please honor Mr. Joy Chakraborty. The super energy throughout the day and also in the past months, rigorously working and guiding for this event has made this remarkable day possible. Requesting Mr. Saurabh to please join the dignitaries on the stage. Requesting all the winners to please stay in the hall for a final group photograph to commemorate this memorable day. And now requesting Dr. Deshpande to please honor Dr. Hardik Ajmera. Today's day has been possible only because of the hard work of these dignitaries who have spared time from their busy schedules. So the thunderous round of applause for all of them as they are felicitated. Requesting Dr. Deshpande to please honor Mr. Krishnan V. And now I would request Dr. Deshpande to please honor Mr. Behram Kodaiji. And now requesting Mr. Joy Chakraborty to please honor Dr. Ramakant Deshpande ji. Later? So group photograph first? Okay. I now request all the winners to please join us on the stage for a group photograph. Yes, and the legendary people who have honored us by their presence. I would request Prakash ji, Mandakini ji, Abhay ji to please join us on stage. Yes, okay. Yes, sure.
So I think I'm going to do the vote of thanks here. More than anything else, thank you to the CII team, the jury members, the audience. I think it's been 4 months of hard work that has come to this. So once again, thank you one and all, and see you all again next year. So let's have the group photograph first. So we'll have to arrange ourselves on the stage.
requesting everyone to please join us for the dinner and also on the day 2 of CII Hospital Tech 2025. Thank you so much. Again, requesting everyone to please join us for cocktail and dinner. And I request CII team to please stay back for a group photograph.